Okay, today we're with Scott Callicutt. Dr. Scott Callicutt is a vascular endovascular surgeon with Premier Vascular Associates in Knoxville, Tennessee. Now Dr. Callicutt will talk to us about peripheral artery disease, sometimes known as PAD. Dr. Callicutt, what is PAD?
PAD is actually a medical condition that occurs when there's a buildup of plaque or blockage, so to speak, in the blood vessels, which results in narrowing of the blood vessels and subsequently reduction in the amount of blood flow to your legs or to other areas of your body for that matter.
Okay, thank you. Now we hear the terms PVD and PAD used a lot when describing disease. Is there a difference between these two terms?
Actually, PAD and PVD are actually the exact same thing. Years ago, we would call PAD or blockage PVD, but now there's been such a focus on arteries and determining arteries as the problem, it's simply easier now to actually call it PAD or peripheral arterial disease.
Okay, thank you. Now, how can someone be certain that they have PAD?
Well, PAD can result in a multitude of symptoms. Most folks, when they have PAD in their legs, generally they'll complain of a weakness, fatigue, or crampy type feeling in their calves or legs when they walk.
Okay, great. What about family history? Is that definitely a risk for PAD?
Absolutely.
Okay.
Most folks who have, whether it be an early onset heart disease, such as heart attack, or early onset stroke, those folks are at much higher risk than the average patient of getting PAD.
Okay. Now, are there certain things that a person can do to prevent PAD?
Absolutely. For the most part, stop smoking.
Oh.
Smoking, smoking, smoking. The more you smoke, the higher the likelihood you are to develop PAD. And smoking itself, the misconception is that smoking causes the blockage. Well, smoking doesn't cause the blockage. Smoking just amplifies the process several times in order to generate the plaque or narrowing of the arteries.
Now, we've sometimes heard that restless leg syndrome correlates to PAD. Is that true?
In actuality, there's no correlation at all between restless leg syndrome and PAD. Restless leg syndrome is essentially cramping at night or jerking motions in your leg at night, and it doesn't correlate with the blood flow to your legs at all.
Okay. What about leg cramps? If you have leg cramps a lot, is that a sign that you have PAD?
Only if you're having leg cramps when you walk. And the way I describe it to folks, generally when you're walking, your muscles demand energy, so they demand oxygen. And when you have blockages in your blood vessels, you get into a situation where your muscles are working and they need more oxygen to work, and you simply can't deliver enough blood supply for it to work. So what happens is the supply can't meet the demand, and your muscles say, hey look, if you continue to walk, I'm going to make you hurt, and I'm going to make you stop because I can't continue to work this hard. And generally that's what happens. Folks with PAD, they walk a certain distance, their calf literally starts to cramp or hurt because it can't do much more work. So you stop, you rest a minute, the demand goes down, the pain goes away, and you can walk again. That's the classic symptoms of PAD.
I'm sure when people may learn that they might have this disease and they have extreme tingling and it does hurt, there's quite a bit of pain, that they may have fear of amputation. Absolutely,
and those folks who are at risk for amputation are those folks who do have pain at night, but they also have that pain before this, the pain when they walk, or they have an open wound on their leg or a sore on their foot that won't heal. Those are the folks who are at risk for limb loss.
Now what about pain in the buttocks, the hips, the thighs when walking? Are those symptoms? Those are symptoms of PAD?
Absolutely. Sometimes it's difficult to discern from those folks who have back pain or spine problems, but cramping in the buttock, cramping in the thigh, when you're walking at certain distances, again relief by rest, is a symptom of PAD.
Okay. Now if someone's been told they have hardening of the arteries and they have really a lot of trouble walking, what are their options?
Well, there are lots of options, and first we work with the primary care physicians about prevention, stopping smoking, controlling your cholesterol, an exercise program, and sometimes even medications like Pletal for example. But then there's some patients who have already managed those problems and then may require, frankly, an arteriogram or a dye test to get a roadmap of what those blood vessels look like, to see if they're a candidate for whether it be open surgery or minimally invasive surgery like angioplasty or stenting.
Okay. Now you mentioned a screening, so if someone suspects that they have some problems and they do want to see their primary care doctor or they want to see a vascular surgeon, there are screenings that can, diagnostic screenings that can determine whether or not they have this disease?
Absolutely.
Okay.
They are non-invasive, easy screening tools like ultrasound or unetic studies, which are simply just putting blood pressure cuffs on your legs to screen for PAD. Very easy, not invasive test, and inexpensive for that matter.
Okay. So there's definitely treatment options for this disease, definitely things that people can do to prevent. Anything else, any final comments on PAD?
I think not. If you really seriously think that you might have a concern whether you might have PAD, you should consult your physician.
Okay. Thank you so much, Dr. Callicutt, for being with us today.
Thank you.